Hello to all the listeners. I am Dr. Sharada Ramdas, Professor in the Department of Food Service Management and Dietetics in Avinashlingam University, Coimbatore, Tamil Nadu. In previous module, we were dealing with gastritis. You would have noted that the persons with gastritis experience flatulence. This is a gas problem seen among any common person. Shall we learn in today's module why flatulence occurs, what are the symptoms, problems and measures to prevent and control flatulence. The term flatulence refers to excess intestinal or stomach gas. Flatulence is not a serious condition, but can lead to discomfort and embarrassment. Excessive gas in the gastrointestinal tract can be the result of several factors. Belching is typically caused while eating or drinking by the habit of swallowing air, that is known as aerophagia. Foods that contain high amounts of air such as carbonated beverages may also contribute to the formation of colon gas. Presence of flatus in the colon is the result of gases formed from food ingestion or fermentation of certain foods by intestinal bacteria. Typically, gas is reabsorbed through the colon wall as it passes through the bowel, but if motility is disturbed, bloating and distension may result, causing abdominal pain. What is flatulence? To say briefly, flatulence is abdominal discomfort due to the presence of gas in the stomach or intestine associated with intestinal movement. It is a common complaint in the tropics due to high residue, spiced vegetarian diet and the high incidence of infestation with intestinal parasites. Do you know when flatulence occurs? Flatulence occurs very commonly after the ingestion of leguminous seeds like Bengal gram, red gram, beans, peas and soya bean. They contain several non-digestible oligosaccharides, enzymes such as raffinose containing galactose, glucose and fructose. These compounds are degraded and utilized by intestinal bacteria, causing flatulence. Now shall we note the physiology of gas in intestine? Normally, gas is present in the intestine in small amounts. It is readily passes, chiefly with the bowel movements and normally odorless. The origin of this gas is twofold, from the atmospheric air and from the foodstuffs. Look at this diagram. Atmospheric air is swallowed during eating and especially while drinking. By far, the greater part of the ingested air is quickly belched because it is significantly composed of 80% nitrogen, which is unabsorbable by the body, and 20% oxygen, which is absorbed in part only. This residue accordingly is forced to make the transit of the entire digestive tract and appears almost quantitatively in the flatus. The following 3 slides reveal that how gas is formed from the foodstuffs. Enormous quantities of gas is produced during the intestinal phase of digestion. The exact amount and composition depending upon the diet. In as much as most of this gas is readily absorbed in the bloodstream to be fixed there or exhaled through the expired air, the healthy individual remains entirely unconscious of this phase of digestion. The greatest part of the gas produced by food digestion is carbon dioxide. The 3 sources of gas produced are in upper small intestine, lower small intestine and in the cecocolon. First source, in the upper small intestine, gas is produced from a mixture of the acid gastric contents with the carbonates present in the alkaline, biliary and pancreatic secretions. Secondly, in the lower small intestine, gas is formed from the possible bacterial decomposition of sugars. It is to be recalled that sugars and starches are normally broken down by enzymic action to monosaccharides, which are readily absorbed as such. It is readily available for decomposition to carbon dioxide by bacterial action. The third source of gas production is in the cecocolon. Here, gas is formed by the bacterial decomposition of cellulose. Cellulose produces carbon dioxide and fatty acids, which in turn liberate more carbon dioxide when neutralized by the alkaline carbonates secreted in the proximal colon. Other gases normally present in small amounts are methane and hydrogen from cellulose. Now you understand how gases are produced in upper and lower small intestine and cecocolon. Now shall we move on to symptoms? All of us are very familiar with the symptoms of flatulence. However, shall we go through the symptoms of flatulence quickly? Feeling of faintness, giddiness or choking, dyspepsia, abdominal bloating, belching, fullness, pain and discomfort after meals, nausea, sometimes palpitation. What are the causes for flatulence? Look at the image. It shows that increased air intake by eating process, gas production in the stomach, inflated intestine, fermentation of food due to bacterial action and intestinal spasm. Gas is produced in the intestines when normal, harmless bacteria in the large intestine break down undigested foods because of a lack of specific digestive enzymes. Gas in the intestine is made of primarily odorless vapors, carbon dioxide, oxygen, nitrogen, hydrogen and sometimes methane. The unpleasant odor of flatulence is produced by bacteria in the large intestine that release small amount of gases that contain sulfur. These gases eventually exit in the body through the rectum. Hydrogen and carbon dioxide are produced after ingestion of certain fruits and vegetables containing indigestible carbohydrates and those with malabsorption syndrome. Large amount of disaccharides pass into the colon and are fermented to hydrogen in those with lactose deficiency. Methane is produced in approximately 1/3 of the population and is influenced minimally by food ingestion. Association of flatulence with poor digestion of foods. Gas also occurs when certain foods are not digested by the body. Carbohydrates such as fiber, starches and sugar sometimes remain undigested because the enzymes that are needed for digestion are not present. The food that remains undigested moves into the large intestine where it is acted upon by bacteria. This process results in the formation of hydrogen and carbon dioxide and in some people methane. These gases are eliminated from the body through the rectum. The same foods that lead to flatulence in one individual may not lead to flatulence in others. There are also certain bacteria present in the colon that can destroy the gases produced by the other bacteria. An imbalance of these bacteria may be the cause of flatulence in some people. Gas is mostly caused by food high in carbohydrates. Some of the common carbohydrate foods that build up gas are sugars, starches and fiber. Sugars like raffinose in beans, cabbage, Brussels sprout, broccoli, asparagus, other vegetables and whole grains. Lactose in milk, milk products such as cheese, ice cream and processed foods. Fructose in onions, artichokes, peas, wheat, fructose used as a sweetener in soft drinks and fruit drink. Sorbitol in fruits like apples, pears, peaches, prunes and sorbitol as an artificial sweetener in many dietetic foods and sugar-free candies and gums. Starches in potatoes, corn, noodles, wheat products, all these produce gas, but only starch that does not produce gas is rice. Fibers such as soluble fiber in oats, beans, peas and most fruits, and insoluble fiber in wheat bran and some vegetables all produce gas. Individuals with lactose deficiency may also experience frequent bouts of flatulence. This deficiency affects lactose digestion. Lactose is a sugar present in milk and dairy products. Poor digestion of lactose may lead to symptoms such as abdominal cramps and diarrhea. Certain ethnic groups have this enzyme present in small quantities. The enzyme levels also diminish with age. Certain conditions that affect the absorption of foods in the gastrointestinal tract are individuals with lactose deficiency, individual with gallbladder problem, malabsorption syndrome, improper bowel functioning or constipation, that is bowel movements may be affected due to various factors such as parasites, problems of the thyroid gland, use of drugs, low intake of dietary fiber, obstructions in the intestine and diverticulitis. Next, swallowing air is one of the causes of flatulence we have already mentioned. Although much of this swallowed air is belched upward through the mouth, a small amount passes into the intestine and out through the rectum. People swallow air in many different ways, particularly by unconsciously gulping air as they talk, especially when they are upset, excited or nervous. Eating or drinking in a hurry, chewing gum, smoking and drinking carbonated beverage, or when the person wears dentures that are too loose. Excessive fiber intake. A sudden increase in fiber intake also can cause increased intestinal gas and bloating. Dietary fibers are the non-digestible, non-absorbable carbohydrates and lignin present in food plants, principally fruits, vegetables, legumes and grains. Increasing the intake of dietary fiber is an important in the treatment of constipation. By excess consumption, it produces unwanted side effects like abdominal discomfort and flatulence. Taking fiber supplements or suddenly switching to a high fiber diet can be risky because high dietary fiber intake may reduce the absorption of minerals such as calcium, iron and zinc. Also, a sudden increase in dietary fiber may cause flatulence, cramps, constipation and diarrhea. Gas is also produced when dietary fiber is fermented in the gut, which may be related to complaints of distension or flatulence. Flatulent accumulation in the intestines may be due to any of the causes. Constipation, rapid eating without properly masticating the food, overfeeding, general debility, indigestion, peptic ulcer, an empty stomach or a delayed meal, putrefaction in the food, certain cases to secretion of gases from the vessels in the walls of the gut. Problems of flatulence. Flatulence is characterized by increased intestinal mobility, cramps and irritation. This occurs after ingestion of certain carbohydrates. The carbohydrates like disaccharide, oligosaccharides and polysaccharides not hydrolyzed by alpha amylase and other intestinal enzymes cannot be absorbed. Lactose is not hydrolyzed in some individuals due to the deficiency of lactase. The di and oligosaccharides can be degraded by the bacteria present in ileum to liberate monosaccharides. The latter can be metabolized by the bacteria. As the monosaccharides are utilized by the intestinal bacteria, gases such as hydrogen, methane and carbon dioxide besides lactate and short chain fatty acids are released. Datta and Halska stated that dietary fiber has been associated with sensation of excessive abdominal fullness and increased flatulence in individuals with pancreatic diseases. Now let us go on to see treatment of flatulence. The patient who cannot expel gas through the anus need to have a rectal tube inserted or an enema to remove it. The treatment of flatulence includes proper chewing of food, adjustment of diet, eradicating intestinal infection, and managing organic disease such as peptic ulcer. Fluid plays an important role in flatulence. About 8 to 10 glass fluid a day help in regular bowel movement. Water should not be taken with meals as it may aggravate distension. Sucking fluid through a straw or drinking directly from a bottle leads to air swallowing. Next, meals. The habit of taking only 2 meals per day should be changed to include 3 or 4 smaller meals. Dinner should be light and eaten at least 2 hours before retiring. Habits and behavior pattern should be examined for possible contribution to symptoms like gum chewing, rapid eating on the run, consumption of large quantities of carbonated beverages or diet candies. Food preparation itself can affect digestion. Soaking legumes increase oligosaccharide digestion by significantly decreasing the concentrations of raffinose and stachyose, which we have seen these are the causes for flatulence. Refrigeration and reheating of starches decreases digestion. Fiber and legumes in a meal can interfere with starch digestion. Garlic is usually added to a tropical diet for taste. It also has the reputation of inhibiting the growth of bacteria in the colon, thus reducing flatulence. Medicinal preparations containing garlic are also available. This will also be useful for reducing the gas production. Gas production can also be inhibited by decreasing the bacterial flora with the antibacterial agent. Emotional factors and other underlying diseases should be identified and addressed to control the flatulence. Here is a list of gas producing food and helpful in controlling gas production. Foods which produce a normal amount of gas are meat, fish, poultry, egg and all nuts. Vegetables like lettuce, peppers, tomatoes, asparagus, avocado, olive and okra. Fruits like cantaloupes, pineapple, berries, grapes and stone fruits. Carbohydrate rich foods like white rice, chips, popcorn and crackers. Food which produce a moderate amount of gas are potatoes, eggplant. In fruits like citrus fruits, apples and pears. In carbohydrate like pastries and bread. The major gas producers are starchy vegetables like root and vegetables, onions, potato, radish, leeks, parsnips, celery and cucumbers. Legumes containing complex sugar raffinose in beans, peas, lentils and soybeans. Fruits containing fructose like banana, dried fruits, raisins, prunes and apricots. It is necessary to reduce lactose, fructose, complex carbohydrates or high fiber fruits and vegetables in the diet so as to reduce the gas formation. Foods that may help control odor or gas: buttermilk, parsley, yogurt, kefir and cranberry juice. Now let us go on to the nutrition therapy. Because eating habits as well as the type of food eaten can contribute to excess gas production, a thorough appraisal of the patient's usual eating pattern and habits is necessary. Specific treatment depends on the source of the gas. Gas forming foods can be avoided on a trial basis to determine if they are a source of discomfort. Remaining upright for 30 minutes after meals may also be beneficial. Nutmeg and maize are useful for flatulence. A tea made from nutmeg, maize and slippery elms is mixed with cream, boiled and drunk when lukewarm to ease flatulence. Nutmeg and maize are also used for abdominal pain. Remedies for flatulence. Some of the most common home remedies for gas trouble. Citrus fruits are thought to help in treating flatulence. Instead of taking vitamin C tablets, boost your vitamin intake through the increased consumption of citrus fruits as well as vegetables rich in vitamin C. Yogurt containing live bacterial culture, that is Bacteria acidophilus, help in alleviating the problem of digestion. Pumpkin is one of the most beneficial home remedies to stop gas. Some remedies for flatulence also includes cardamom. By adding cardamom seeds to vegetable or rice dishes, or it can be added to boiling water or chew them whole. Cloves are one of the most effective natural gas remedies for adults as they improve digestion and remove gas from the body. Home remedies for gas relief include even coriander. It aids in digestion and reduces abdominal cramps. Crush a handful of coriander seeds into a powder and add to dishes. Fennel seeds are a popular remedy for indigestion and flatulence. Steep half a teaspoon of fennel seeds in a cup of boiling water and sip throughout the day. You can also chew on fennel seed after meals. Crushed fennel seeds may also be added to foods while cooking. Herbal teas are highly beneficial for reducing flatulence. Add half a teaspoon of chamomile, peppermint, aniseed, basil or sage leaves to a cup of boiling water. Add some honey to sweeten the tea and drink twice daily. Turmeric is another effective home remedy for digestion trouble. Now let us see the dietary management of flatulence. The flatulence diet should consist of foods that are easy to digest and beneficial for proper functioning of the bowels. Here are some dietary tips to prevent flatulence. Dietary fiber is necessary for proper functioning of the digestive system. Excessive intake of fiber may contribute to flatulence and bloating. Regulate intake of foods that contain soluble fiber such as beans, carrots, peas, barley and apples. Certain sweeteners used in sugar-free foods may trigger flatulence when consumed in high amounts. Flatulence arises due to food intolerance in some people. Most common food triggers include dairy products, gluten and fructose. Try to identify the foods which cause flatulence and avoid them as much as possible. Recommendation: eat at least 3 meals a day at regular intervals. Chew food thoroughly. Drink 8 to 10 cups of fluid each day, may be increased during hot weather. Eat a small evening meal. Try new foods one at a time. Do not eliminate a food from diet without trying it several times. Now let us see helpful tips for controlling gas. Avoid spicy foods and caffeine, both of which stimulate rapid transit. Avoid beer and other carbonated beverages. Soak dried beans overnight and rinse prior to cooking. Eat slowly and chew food thoroughly. Avoid talking and drinking while eating to prevent air swallowing. Eat smaller, more frequently meals. Avoid overeating. Avoid drinking through straws, chewing gum, sucking hard candy and smoking. Maintain well-fitting dentures. Avoid both constipation and excessive use of laxatives. Try to remain calm. Anxiety, which causes air swallowing. To conclude, in the dietary management of flatulence, It is not only to make changes in diet, but also to make changes in eating habits. Eat smaller meals through the day instead of the traditional large lunch and dinner. This helps to ease digestion and reduce the risk of flatulence. With this module, we have completed the dietary management for gastrointestinal disorders. Let me sign off now and bye to all the learners. Thank you for the patient listening.